I'm Liz Hammercott. I'm the Senior Probation Officer for Sentence Management, and I am based in Bridgewater. So just a little bit about the probation service. So it's quite a multifaceted role being a probation officer. So I've included this infographic in this presentation just to show the kind of different aspects that the job involves. So we supervise people on prison licence once they've been released from custody, and people who are on community orders. So just working with them while they're in the community, but we also start that process with people prior to their release. So that could include, for the more serious cases, completing parole reports to help inform the parole board in making a decision about whether to release somebody into the community, so if they're safe to be managed. Sorry, my slides aren't working as I was hoping. So really thinking about our key responsibilities is around assessment work. So we use OASIS, which is the offender assessment system, and that's a clinical tool, and we're looking at somebody's risk of reoffending and if they did the risk of serious harm. And from that, we build a sentence plan. So what interventions we're going to put in place for somebody to reduce that risk, but also if there are any controls that we can put in place to mitigate risk. So it would be, for example, somebody on prison licence would have a set of specific licence conditions to help manage the risks to existing or potential future victims. So just thinking about our signposting to different agencies. So we have teams within the probation service. So we have an interventions team that run accredited programs that are specifically focused around domestic abuse, people who have sexual convictions, and also a more generic thinking skills program, which is looking at somebody's problem solving and consequential thinking. We also have CFO3, which is an education and training provider. We have community rehabilitation services that deliver specific work around emotional well-being, around accommodation, and again around education, training and employment. More recently, we've started piloting a neurodiverse service. So people within my team can have a consultation if they are working with somebody with a neurodiverse condition, and they're also able to offer one-to-one support direct to the person on probation. And we also have the OPD, the Offender Personality Disorder Pathway. And again, they work very closely with the mental health team, quite often advising officers, but also sometimes providing a bespoke treatment pathway to people that we're supervising. We also work and signpost to DWP. We work very closely with the Women's Centre, which is run by Nelson Trust, which happens to be based in Bridgewater, Somerset Drug and Alcohol Services, mental health teams, domestic abuse services. So a range of partnership agencies that we would then signpost into. So thinking about how we contribute to multi-agency working, we have statutory multi-agency working arrangements that we partake in. So some of you may or may not have been to MAPPAs, which is the multi-agency public protection arrangements. And these really are for the critical few people in the community who pose a significant risk of harm to others. And that is quite often chaired by the police and probation, so I chair some of those meetings, and we look at risk assessment and risk management plans across the agencies to pull a really clear risk management plan together to manage that person. We also contribute to MARIC, which is the Multi-Agency Risk Assessment Service, which again is linked directly to domestic abuse. And often we quite often hold people who've again committed those domestically abusive offences, and it just helps us get a good oversight of the bigger picture in managing that person. And then we have child protection, so we have a statutory duty to safeguard children. So with every person that we supervise, we run background checks to see if they've been known to children's social care, regardless of whether they have children themselves, so that we can again make that assessment and put in plans in place as needed. More regionally, we have a homeless prevention team. So again, that's made up of probation. We work very closely with local councils, accommodation providers and accommodation support in order to ensure people aren't released from custody homeless. And we also take part in vulnerable women meetings. So that's again with the Nelson Trust. We have integrated offender management teams. So that's where we work very closely with the police to target specific cohorts of offenders. So that would be what used to be called the prolific and priority offenders, so people that have committed serious acquisitive crime. But also we have a cohort for domestic abuse perpetrators. And then our third cohort is the high harm team, which would deal with people who have committed serious sexual offences or serious violence. And it just adds an extra dimension to understanding that risk and managing that risk across the agencies. And I mentioned earlier the OPD team, which is embedded within probation, but it has a forensic psychologist and assistant psychologists attached to those teams. And again, that works with people who have significant mental health diagnoses. More recently, we've started developing a closer working relationship with the DWP because we do supervise some very vulnerable adults. So we've got a good link in with them in terms of supporting people to make sure they're accessing their benefits appropriately, any issues that they may have, or if there are any issues in terms of their attitude towards staff in the DWP. And through that, we've started developing a partnership with Western College, again, to support people into education and training. And we've got Julian House, who are an accommodation provider for us, and we work very closely with them, again, to support people in maintaining their accommodation.